Hi, I'm Michael, and this is California. And oftentimes when we think about Medicare, we think about our parents or maybe our grandparents getting the age of 65 years old and being able to lay claim to a benefit that they paid into all their working life, and getting health insurance benefits that tend to be less expensive and have wider acceptability than most other individual health insurance options. Now, although this does represent the majority of Medicare recipients, there are still around 9.1 million people in the U.S. who are on Medicare and are actually under the age of 65 years old. This is because it is possible for U.S. residents to get Medicare benefits if they're under the age of 65, primarily in the case if they are disabled or have specific diseases. So today we're going to discuss Medicare for people under the age of 65 and who is usually eligible for the program. Now, before we do that, if you like this information, if you find it interesting, if you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Let's talk about Medicare in general and how it applies to people who are under the age of 65 years old. First, Medicare is a program that is funded by payroll taxes, federal and state money, as well as monthly premiums paid by the individual. For most people who apply for Medicare, they'll have to have paid into the program the entirety of their working life. And at a minimum, they have to pay into the program for 10 years or 40 working quarters. Once someone has worked enough quarters, they must either reach their Medicare eligibility age, for most people that's at age 65 years or older, or become disabled or have specific health conditions that would allow them to qualify for Medicare prior to turning 65 years old. Once they are enrolled in Medicare, that's usually Part A and Part B, also known as Original Medicare, they will usually still have to pay a monthly premium for a portion of the Medicare coverage, which in 2020 is $144 a month for Part B, as well as other costs associated with their health care. But these costs can be reduced if someone applies for a Medicare Advantage plan or Medicare Supplement plan, and can be paid in full if they apply for programs like Medicaid or Medi-Cal or Medicare Savings Programs, and if they are eligible based on their income. The majority of people who are receiving Medicare under the age of 65 are because of disability. And this happens automatically once someone has been receiving Social Security Disability Benefits, or SSDI, for 2 years or 24 months. Now, this does not include the 5-month waiting period that most people must wait to be able to qualify for SSDI. So in totality, they will usually have been waiting for a total of 29 months after they become disabled to become eligible for their Medicare coverage. Now, 3 months before their 24th month of disability, they will receive a red, white, and blue Medicare card. And this can be used to obtain Medicare health services under Medicare Part A and Part B, but does not include medication coverage, dental or vision coverage, or extra coverages when they only enroll into Medicare Part A and Part B. Now, once a person turns 65, then their Medicare eligibility becomes based off their age rather than their disability. And this is an important transition because once someone turns 65, they will have an additional one-time option to change their Medicare health plan or Medicare supplement plans. Another important way that someone can qualify for Medicare prior to reaching age 65 is to be diagnosed with a specific illness. The two main illnesses are end-stage renal disease as well as ALS, also known as Lou Gehrig's disease. End-stage renal disease is a disease of the kidneys, and it's when the kidneys stop working. So usually these folks will be on dialysis and can be in the process of getting a kidney transplant. For people qualifying for Medicare based on their ESRD, they do not have to wait the full 24 months like people who are just on normal disability. Their Medicare plans can actually start the 4th month after they start their dialysis treatment. Now, for people who are qualifying for Medicare based on ALS, Medicare can start immediately once they start collecting their Social Security disabilities, and they don't have to wait for the 24 months either. One important decision that people who qualify for Medicare under the age of 65 will have to make is whether or not to get additional Medicare coverage. This is because Original Medicare, or Medicare Part A and Part B combined, don't cover all the costs, especially when it comes to things like limiting healthcare costs, dental coverage, vision coverage, and prescription drug coverage, which for the most part are not covered under Original Medicare. To qualify for a Medicare Advantage plan, people must be enrolled into both Part A and Part B coverages, and this applies equally to anyone qualifying for Medicare based on age or based on disability. Medicare Advantage, or Part C as it is sometimes called, is a program that is offered by private health insurance companies and is not run by Medicare, but works as a way for people who qualify for Medicare to get additional benefits that they can't get under Part A or Part B only. An alternate option to a Medicare Advantage plan is something called a Medicare Supplement or Medi-Cal plan. These plans will have an additional premium on them, and they vary based on their benefits depending on the plan level that someone chooses. But in short, Medigap plans are insurance plans offered by private health insurance companies, and they pay much of the costs that are not covered under original Medicare. That's Part A and Part B. One very important thing to note about Medigap plans is that when someone first becomes eligible for Medicare, they will have a one-time opportunity to enroll without having to go through medical underwriting. So medical underwriting is a process that insurance plans use to either accept, decline, or increase the cost of a plan based on an applicant's pre-existing conditions. And this does not apply to Medicare Advantage. This is just for Medicare Supplement or Medi-Cal plans. And in some cases, if someone's applying for Medi-Cal and they are under the age of 65, their only opportunity to apply for a Medi-Cal plan will be in their initial enrollment period when they cannot be declined because of their health conditions. Additionally, Medi-Cal plans do not include prescription drug coverage, so that would need to be purchased separately as a standalone plan. Overall, if you are disabled or have ALS or ESRD, then you will be able to apply for Medicare even though you have not reached the eligibility age of 65 years old. Additionally, once you get your Medicare, you will have a lot of choices to make about what types of additional coverage you may need and what plans fit you best. Especially in that time when you're initially eligible for Medicare, this is really important because it's the only time, that short window, to ensure that you have all the options available to you through Medigap and Medicare Advantage plans. Thank you so much for watching our videos, and I hope that you found them interesting or helpful or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments, leave them down below. We love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can. Now finally, we here at California, we know health insurance. So whether it's private health insurance or Covered California or Medicare or Medicaid or Medi-Cal or even health insurance for a small group, we know health insurance. Because I know it can be very complicated coming out of your work insurance, trying to find health insurance on the private side. Or maybe you're turning 65 and you're trying to figure out what are the Medicare options that fit your needs as well as your budget's best. Or maybe even you're coming out of a government program like Medicaid or Medi-Cal, and now you have to get health insurance on the private side. We can help with all of that. So if you have questions about your healthcare, leave those down below. We'll be happy to make a new video or post for that as well. Now, other than that, I am Michael, and this is California, wishing you a happy, healthy day.